My name is Michelle. I know a lot of you guys here already know me. I have a presentation for you today on empowering healthy aging and preventative health care and safety for older adults. So I've set up a couple objectives for you guys. By the end of this presentation, I would like for you to be able to recall some of the chronic conditions that you guys are facing here in the CLC, explain the link between chronic disease and safety concerns. I want you to be able to implement strategies to prevent these safety issues and manage your disease. I want you to assess your own personal role in this disease process, and I want you to evaluate the effectiveness of the prevention strategies that we come up with and develop a personalized plan for you, your disease, and for your life, what works for you. So, first, chronic conditions like diabetes, hypertension, and arthritis are super prevalent amongst veterans here in the CLC, and it can increase our risk for safety concerns. So, a big safety concern here that I identified within my time here was falls, which can lead to serious injuries, reduce independence, and decrease your quality of life. My goal is to empower veterans with the information and the tools necessary to combat these safety concerns and manage their disease long term. So, some chronic conditions that I identified that you guys are facing are diabetes, hypertension, and arthritis. Diabetes is impaired blood sugar regulation, so usually too high or too low sugars causing issues within your bloodstream. Hypertension is a high blood pressure, and arthritis is actually inflammation in your joints causing pain and stiffness. So, all of these play a big role in fall risks, which was something that I identified within my time here. They affect your balance, your vision, your mobility, and they also increase your likelihood of having a fall. So the link there is balance and mobility is a big thing about it. I know a lot of you guys I've seen like once you get up and going, you're good, but that initial standing up and having like a wobbling within your stance these conditions can play a role in impairing your mobility and your stability. Certain medications that you guys are taking, I know you told me they cause dizziness, maybe issues with your vision, and increasing your risk of a fall. And then also vision in general, like I know a lot of you guys with diabetes have issues with your vision. You tell me you have bad eyes or you wear glasses. And then hearing as well, not being able to hear someone say, hey, watch out, something's right there, can increase your likelihood of having a fall or not being able to see certain things. These can all contribute to the likelihood of having a fall, and overall managing our chronic diseases would help prevent things like that. So I've come up with some strategies for chronic disease management. So first, medication adherence is a big one. For all of you guys with diabetes, I want you guys to focus on taking your insulin as prescribed. I know the aides and the nurses come around with your insulin. It can be annoying, it can be a drag, but it really, really helps to combat the fluctuations in your blood sugar when we closely monitor your sugar and treat it effectively with your insulin. So I just want to educate you on the importance of taking your insulin at the times they're prescribed. Also monitoring, so regular monitoring. So for example, with insulin, we do check your sugars pretty often. I know it can be annoying getting that little prick in your finger, but that prick in your finger is our way of understanding what your blood sugar levels are looking like and how best to treat and combat them. So keeping track of your blood sugar is super important in the management of your disease. And then finally, lifestyle modification. So having a nice, healthy, balanced diet, engaging in regular physical activity, and stop smoking and drinking. I know a lot of you guys already don't smoke and don't drink, but for example, with the yoga exercises, the yoga chair exercises that I know I personally taught a lot of you guys, those are super important in terms of controlling overall health, and they play a big role in managing your blood sugar. As for high blood pressure, I know a lot of you guys get your blood pressure pills, and taking those on time when you're supposed to take them are super important. And also having us check your blood pressure in your arm as often as we do is super important as well, so we can see if the medication is working for you or if it's not working for you. And then also diet plays a big role. I know a lot of you guys are not supposed to have salt and you do anyway, but I just want to educate you on the importance of sticking to the diet that the doctor and the nurses have created for you in order to help you and help your health and your disease progression and prevent safety concerns from complications of your disease down the line. So I've also come up with some fall prevention strategies because that's a big issue that I identified in my time here, as a lot of you guys are having issues with falls. So first, room safety. I want you guys to be agents of your own healthcare and feel empowered to have someone remove tripping hazards. So if you notice something that's like cluttered or rugs or tripping hazards anywhere, have someone come in and remove them. It doesn't hurt to ask someone, hey, can you move that? Like, I feel like that might be an issue for me down the line. And I think any of the nurses here would be more than happy to help you with that. And then this is more so for people who are transitioning back home. Installing grab bars. I know in the hallways a lot of you guys see and use them, which is great. We have the grab bars on the walls in the hallways. Those are super important for stability and helping prevent falls. I'm so happy that you guys already use them, but for some of you maybe transitioning home, it might be nice to talk to your family, talk to your doctors about maybe getting those installed in your home, in your showers, etc., to help just keep you safe, and it's just like a preventative measure. And then also lighting, super easy thing. Flip some lights on. I don't know how many times I'm getting up at night and I trip over things because I didn't turn the light on. Just always turn the light on. It's better to have a clear vision of what's in front of you so you can avoid certain things and just be able to maneuver your environment more safely. And lighting is an easy way to fix that and help keep you super safe. And physical activity as well. Engaging in exercises that improve balance really help with our overall balance, mobility, and stability. So I know personally I did the chair yoga exercise with you guys, which was super great, and doing active range of motion exercises, which I taught you as well, with your arms and your legs, maybe when you're sitting down or at any time, just to promote stability and strength and build strength to help you, be more stable in your stride when you're walking, etc. And then finally, regular checkups. I know people like nurses and stuff here check up on you all the time, but as you're transitioning outside of here or even in here, being an advocate for yourself and requesting certain healthcare things like having people come to check up on you, etc., can be super helpful in the long run in terms of, having access to overall like checkups. So whether that be while you're still here in the CLC or when you transition out of the CLC, having regular checkups and asking sometimes, because I know some of these things can be overlooked with everything going on. So maybe asking your nurse, hey, I haven't had an eye exam in a long time. When can I have one? Can I have one? And then also reviewing your medications that you're taking right now. So as your disease progresses, we want to make sure that the medications are still working for you. So maybe when you were diagnosed 5 years ago, you might not need the same dose that you need today. So also just being an advocate for yourself, reminding your provider like, hey, is this level of the medication still good for me? Things like that, super important, super helpful to help prevent safety concerns. And then now I have a scenario for you guys. I want you guys to take this opportunity and discuss with your peers a scenario. So a veteran with diabetes and arthritis reports feeling unsteady while walking. How can the strategies discussed help this individual manage their conditions and reduce their risk of a fall? So I want you to turn to your neighbors around you and just discuss what you think is an answer to this question. What are some strategies that can be used to help manage their condition, one, and two, reduce the risk of a fall? So then I'm gonna let them just talk for a couple minutes about this, and then I'll come back, and then when we come back, okay, so then I'll be like, all right, so this was super great. I heard some great ideas. Overall, everything that I mentioned earlier with the lighting, with the hand grab rails, with having medications, better titrated to your current level of your disease. All of these things, plus some of the things that you all said, are really great ways of managing your condition and reducing your risk of falls. Great job, guys. So yeah, I'll do that. And then for evaluation and reflection, I just have some questions that I want to leave you guys with to just keep on your mind. What are your personal risk factors for chronic diseases and falls? So think about yourself. What risk factors do you have? Just think about that, for chronic diseases as well as falls. Because understanding where we stand can help us prevent progression of our diseases and also prevent safety concerns like falls. And I also want you to think about what strategies you can implement in your daily life to manage your health and prevent falls. So tailor it to yourself. I know me personally, I might get out of bed at night without turning on the lights. So I would change that by turning on the lights when I get out of bed. So just think about what are some ways you yourself can prevent falls. And then how would you assess the effectiveness of these strategies? So how are you going to make sure that these things work for you? So I want you to make it super personalized, tailor it to yourself. How is it going to work for you? Then also, I had some goals that I set when I initially started working with you all. So I just want to do a reflection of the goals that I had set and, see if I met my goals, see where I could improve. So my first goal was providing education to elderly adults about preventative health care. I wanted to be able to identify a space or platform where you residents could receive information, which I was able to. In our east wing, the hallway, we have the information board, which I was able to put some things up there too and direct you guys to that board whenever you're free or have time to go take a look at some stuff. So that's a great place for me to put information that I need to get across to you guys. I wanted to have a rapport with at least 2 of the residents. I think I surpassed that. I have a good rapport with a large amount of the residents. And then I wanted to be able to create a method to evaluate the information that was taught and have at least one resident verbalize understanding of what was taught. So this was my method of getting an evaluation of their understanding of what was taught. During that discussion, I'm able to assess what parts of my education stuck with them, and they were able to contextualize and bring back up and verbalize themselves. So I was able to meet that initial goal. Then I have another goal: learn about how to best care for the geriatric population and keep them safe. I wanted to evaluate current practices used in the facility, which during my first 2 or 3 weeks here, that's what I was kind of doing. I was waiting and just observing everything. I was having discussions with the residents, talking about their current practices and what safety looks like for them or what they understand about their disease. And then so I was able to do that. And then I wanted to create a new practice that would increase safety or overall wellness of the residents. I was able to implement the chair yoga. Every day I was here, we did 5 minutes of chair yoga. We sat in the chairs, did our chair exercises. These promote stability, mobility, strength, and just overall help with balance, help with wellness overall for the residents. And then finally, I wanted to conduct research on different ways or practices that could be introduced to the facility to best support residents. And I decided, working with my preceptor, we talked about introducing mindful minutes to the CLC. So just taking some time each day on the overhead speaker to give a minute of mindfulness where everyone can just reflect on their day, reflect on their life, take a couple deep breaths and just a moment of silence. So just have a peaceful and mindful time to ourselves. So I think that would be a really good way for the residents to relax, have relaxation and wellness. And I just wanted to leave you guys with a couple things. In conclusion, education and trust equals empowered aging. I want to thank you guys for trusting me and trusting your nurses and your aides and allowing us to be a part of your healthcare process and allowing me to educate you on some of the stuff I learned and some of the stuff that I think would help you. So I just want to thank you guys for that. I want to let you know that safety is not just about prevention, but it's also about dignity and independence. So I want you guys to feel empowered with your own health care.